thank you so much, Dr. Kadrin, for joining us today. It's really our honor, and we're really humbled to have you.
Well, thank you very much. It's my pleasure.
Thank you so much. First of all, could you tell us a little bit more about yourself?
So I am a professor at the University of Pennsylvania, where I moved there in 1999. I was initially in the Navy, where I did research on the immune system. And we did our first trials in infectious disease in patients with HIV. And that's where we first tested CAR T cells. And then in 2010, we started treating patients with leukemia with CAR T cells.
That's cool. So could you tell us what's your comments about today's symposium, immuno-oncology trends?
Sure. We're in a very exciting time where, the CAR T cells just became FDA approved last year in the United States for leukemia and lymphoma, and now we have a very rapid worldwide growth in CAR T cell research. And what I described today was that in China, it's actually the most active geographic region in the world now.
Yeah.
And there's a very, I think, robust and enlarging cooperation between China and U.S. in this research. Interestingly, it's been less active in Europe, so this is primarily Sino-American interaction.
Yeah, that's perfect. As we are SAPA, we're trying to bridge the gap between China and the U.S. And what do you think of today's event? And what's your general impression about SAPA-GP?
So I think SAPA-GP serves a very important bridge between China and the U.S. because it's a very rapidly moving area, and having communication can accelerate the research.
Yes.
And I think that's what we're seeing because it's so rapidly moving. Even day by day, it's hard even for me to keep up with it.
Yes, definitely. I totally agree. So you mentioned that CAR T has entered the space of solid tumor and also multi-targeting for oncology therapy. So what do you think, like SAPA-GP's role in terms of helping promoting this process and its innovation and success?
So I think SAPA-GP is really well positioned to help coordinate the massive research in the U.S. and China. And also because there are very different, as we've heard today, very different and important differences in different kinds of cancer that are most common. In the U.S., the most common cause of death from cancer is breast cancer. And we saw in China it's lung cancer and liver cancer. And so the very different kinds of cancer, I think that the immune system will be used and work very effectively in all kinds of cancer, but there will be some differences in how we actually do that. And SAPA-GP can help, I think, coordinate this so that it happens most rapidly.
Excellent. So we have a series of scientific symposiums starting from last year, which was gene therapy, and today is immuno-oncology. What would you like to see in next year in terms of a new, topic for a new symposium?
So I think, it's very rapidly evolving precision medicine.
Yeah.
I think one area that would be very important would be bioinformatics and artificial intelligence and how we understand the data that's coming from these trials. And in China, there's a much leading work in artificial intelligence and bioinformatics. And so I think that's really a major issue, is how we go from a tumor biopsy and then understand what the best treatment might be.
I see. We'll consider precision medicine and bioinformatics and AI next year. Our last question for you. We have a lot of volunteers, and a lot of them, supporting SAPA-GP are young professionals in pharmaceutical industry and students in STEM field. Could you give them one inspiring suggestion, to encourage us to fulfill our career?
Yeah, I was very excited to see that many of the members here at SAPA-GP are young, early stage in their careers. And this is a very important way for them to network into this international area of research in cancer. I think it's a very exciting time to enter this because we're just at the beginning of getting very effective therapies in cancer, and it's important both in China and the United States.
Great. All right. Thank you so much for
Okay.
the time. We're
Sure.
really happy to have you.
Okay, great.
Thank
And,
you.